Fantastic. Once again, happy married life to everyone who is celebrating today. And of course, we hope you have a very smooth ceremony today. All right, now to the next leg or to another discussion on the program, TVC News or TVC Breakfast Saturday. According to health reports, there are thousands of avoidable deaths yearly, and this is due to unregistered or unqualified health practitioners administering wrong treatments that result in avoidable fatalities and health problems, which in turn puts the public's health at risk. And this has also damaged the reputation of nurses and healthcare practitioners while creating a sense of distrust between patients and these professionals. The Nursing Students Association of Nigeria is now calling for urgent regulations to checkmate this act and ensure quality healthcare delivery in the country. Joining us now for this conversation is the National President of the Nigerian Universities Nursing Students Association, Khadija Adefunke Jimo. It's good to see you and welcome.
Good morning, Ma. Thank you so much for having me on your show. Good morning, sir.
All right. So let's cut right down to the chase. How much of a problem is this for you? We're speaking with you as an insider. You also occupy the enviable position of the #1 in the association. How much of a problem is this for you all?
Okay, so I'll be speaking from the perspective of students, of nursing students. So as a nursing student, you've undergone rigorous academic skills, you've undergone the clinical practice to become a nurse, and then you just meet someone out there telling you that nursing is all about practical, being able to just administer injection, make beds and all, because they believe they are equal to you. They know the practical skills, they can administer injection, they can administer intravenous infusion. Rather, nursing is much more than this. So nursing is a course that involves psychomotor skills, agreed, but there is a big level of intellectual skills involved. As a nurse, you need to be able to assess your patients. I feel like that's the most important part of nursing. You need to be able to assess your patient, know what is right for your patient, know the right drug for your patient, and know your scope of practice as a nurse. So most of these quacks, they don't know their scope of practice. So they end up doing what they are not supposed to do, and they don't even know when to refer. So in the field of medicine, we have specialties in different areas. So if you are still practicing as a general nurse, and they are not even general nurses because they are not trained, so most of them, they do more than what even a family doctor would do. They do more than what sometimes a specialist would do. Some of them even go to the extent of almost conducting surgeries.
That's the quacks.
That's the quacks.
Which can never happen with a qualified nurse.
A qualified nurse knows when to refer. A qualified midwife knows when to refer. She knows the scope of her practice, but quacks don't know the scope of their practice. Apart from not knowing the scope of their practice, they are not trained. So when they carry out these tasks, they forget that these tasks involve intellectual ability. They think it's just about the practical. As a nurse, when you want to administer injection, there are certain things you look out for in the patient. You're not just administering the injection because you know about the whole anatomy, you know the physiology. So if you want to administer injection in a particular area that you've been ordered to administer injection, if you come across something else there, because of your ability to think, you can also say, oh, doctor, I can't administer the injection in this area. There's this problem, I think it can be done this way. But quacks, because they don't have these skills, so they just do what they are ordered to do.
You're saying qualified nurses serve, in as much as they do what they are ordered to do, they also serve as advisors to the doctors as well when there are issues.
Not even just advisors, like we can stand for our patients, we are advocates for the patients.
Okay, so what do you think has contributed to the high level of quackery we see in the profession?
Okay, yeah, first off, I would say maybe because of the way nursing started. So nursing did not start as a profession that was studied in the university or colleges. Nursing started as family members, women in the churches assisting people, women assisting people in battlefield and all. So nursing started in that area before it became a course that now had the scientific aspect to it, because now for everything you do in nursing there's a scientific rationale. But when it just started as a practical skill. So people still think it involves just this practical skill. Most people have not seen the scientific part of it. So that's one major thing. Then what has made it also advanced, I would say in Nigeria particularly, is because we don't have strict regulations. Most of these quacks still walk around. You see them post their flyers online saying they are quacks, admitting it publicly that they are quacks, and nothing is really done to them.
What are these telltale signs? Let's pinpoint them now for the benefit of the people, especially for these quacks, as you call them, who ply their trade online.
Right. Okay, yes. So you see some of them telling you that, oh, I'm going to be graduating on this day as a quack. I studied at this chemist shop.
Did they say as a quack?
No, not as a quack. They call themselves as a nurse.
Okay.
I'm just referring to them as quack. But they call themselves nurses.
So what's the telltale sign for
identifying them?
Right.
How do you identify one that's a quack?
Quack. Okay, thank you. So one major way by which you can identify a quack is through their level of understanding. When you listen to them speak, you just know they are not nurses. So you complain to somebody that you have malaria, the person did not even tell you to undergo any test, and the next thing is that, okay, I'm going to give you intravenous infusion to flush out the malaria parasite. And then you are wondering, is that the drug I need to take? How are you even sure that I have malaria? You've not asked me questions. You've not asked me about the signs and symptoms I'm feeling. So these are the major things that can make you identify a quack. Most of them, they jump into conclusions. They don't assess their patients well before treating them. That's one thing I've noticed about quacks. And they're just about giving injection because they know, okay, they are going to get more money by administering injections and intravenous infusion to the patient.
Right.
Okay. So
Theophilus asked a question earlier as to what led to what has led to the rise of quackery in the profession, and what comes to mind, especially for those of us in Lagos and even across the country, is the issue of what happened to Mohbad. Many people can relate to it. Perhaps another reason, again, I'm asking two questions now. First, what went wrong from your observation? What did the nurse in question, because she's been indicted, but give us another perspective to it as to what went wrong, because that's the go-to for many people. The rich, the poor, the average, that's the go-to. I have a headache, I have a nurse friend, a nurse family. Just call the person. Just call the person. And for many people, it has worked, even though they may not be the trained nurse, as you call it, but it has worked for them. But then we've also had cases where it backfires. I think
we've had so many unlucky cases than the ones that have been lucky regarding this area. So if you're sick, if you are ill, you need to confirm your diagnosis before being treated. So that's one major thing. But what most people do is that they just allow people inject them. Most times injection is not the solution to your health problem. Sometimes oral medications can solve your health issues, not just injections. But Nigerians have gotten to that level where they only feel comfortable when the nurse administers injections to them. So that is one major thing that has been affecting our country.
So you're also saying that Nigerians are also susceptible, are also contributing to all of these things?
Yes, we are. Because when they go to the hospital and then they just tell them at the hospital, okay, you have to undergo the following test. Then after doing the test, you bring your results back to the hospital before we can make a diagnosis. Some Nigerians see it as a long journey.
Now, sometimes when you go to the hospital, you're very ill and you're told to take a test. The result comes out in 3 days. How do you go between today and 3 days time before the result comes out?
I'm sure.
That's why, possibly that's why many people go to these nurses for quick intervention.
Okay, I'm sure the managing doctor would have assessed the patient well and know if the patient will be able to fare well within those days. And if not, can even give the patient some drugs that the patient can stay on till the test results will be out. But most times Nigerians are usually impatient and we just want to get to the base of it. Telling me to do this test, I don't have money, I don't have this thing, and then there's a nurse out there telling me that, there's a quack out there telling me that, okay, I'm just going to give you this injection and you are going to be well in how many days. So,
talking about finance now, you know the healthcare sector healthcare is quite expensive, and largely in Nigeria we actually pay for healthcare out of our pockets.
Yeah.
So what can the government do to ensure that this is sorted so that we don't have these kinds of issues?
Well, I'm very aware of the fact that healthcare is very expensive because I actually contributed to a research that was done recently on pediatric surgeries, yes. So I'm very aware that healthcare is very expensive. So, it has to do with the federal government majorly. So through subsidizing of healthcare, we need many private organizations to come in to subsidize healthcare. Healthcare is very expensive. You see a lot of patients that remain in the hospital even after discharge because they cannot afford the cost of care. Right. So I'm very aware of this problem, and I think the federal government can do it alone, especially now that we are losing a lot of global support that we do get before. Right. Yeah, so I think private organizations in Nigeria need to come on board to support in one way or the other.
So finally, nailing it down about the issue of curbing quackery, I know your association is now talking about intensive regulations and all of that. How do you feel this will work? Okay,
so first, we'll be having a walk against quackery very soon. That's on the 10th of April 2024. And we are calling on all Nigerians to support us in this work, where we would be advocating for professionalism in nursing and for people to stop employing quacks in private hospitals, because most private hospitals actually employ quack. They get people that train them, and as a nurse, you can't be trained by a doctor. A doctor can't train a nurse. We see our doctor counterparts trying to do this, so you can't train a nurse. So we are going to be advocating for this, enlightening the masses about how to identify who a true nurse is. So we're also going to be calling on the Nursing and Midwifery Council of Nigeria to review their regulation. We have a Nursing Practice Act in Nigeria which governs nursing. Yeah. So according to this practice, if a quack is caught, he or she only has to pay a sum of 1,000 naira. That's a minimal fee. And most times they don't even go to the extent of catching them. So the whole process is messed up. So we'll be advocating for a change of this.
All right, Khadija Jimo, thanks a lot for speaking with us on TVC
Thank you so much.
Breakfast Saturday.